in the urban settings, they will enjoy the specialized care. When Madam President became became the full president from 2021. When we started, we said 2021. When we started, we said, is it possible? Let us try. We started reviewing very stringently to every maternal death and every newborn. Stringently, we review through the Zoom review. And yesterday, I'm happy to say that the minister was part of the reviewers. She participated. And the other ministers who were passing through this sector as well, they participated. Through those accountability mechanisms we put in place, we saw more cases are attended adequately with specialized care. Evidence are used to transform the health sector so that it can mitigate various challenges. So in short, I would say, one is political will. Secondly, make services available close to the people. And here the coverage is 80%. And thirdly, use the little available resources to reach the underserved population. I submit it to you.
Thank you for that energetic account of what it's taken. We saw some of this actually just yesterday when we had the pleasure of discussing. With you and Honorable Minister in terms of the progress that has been made, and saw the meeting live actually. Many of the from around the country, many of the different doctors calling in, and Honorable Minister sharing some of the approaches that we can take. It's great to see that come. Dr. Sunday, we come to you for the next question. You've been thinking about this challenge and trying to scale up particularly CMONC services. During that experience in Western Tanzania, what surprised you the most in terms of what you learned implementing those services that stood out for you?
Thank you very much, Dr. Raza, and our guest of honor, Your Excellency President of the United Republic of Tanzania, senior delegates here, and all the invited guests. I'm very honored and humbled to be on this panel. It's a momentous occasion that I think will really give us the impetus to race toward SDG 2030. Now, come back to your question. The work that you are referring here is the program to reduce maternal mortality that was implemented in Kigoma, a 13-year program that started in 2006 and all the way to 2019. It was led by the government of Tanzania, the driving seat, and supported by Bloomberg Philanthropies, H&B Aja Group. And we worked very closely with the Ministry of Health for technical guidance, and as well as the President's Office, local government authorities, and the other key partners. Why I'm setting this stage is because this program was successful in a way that we are talking about this today, because we had a voice and mentor here mentioned about the political will. It was really a political will walking the talk that we really need to reduce maternal mortality. And this will was not actually just spoken. It was translated into a number of policy as well as implementation commitments. We are aware of the National Development Vision 2025, which actually is ending this year as we are developing another development vision. If you read that development vision, clearly prioritizing reproductive maternal services, actually calling for 75% reduction of maternal mortality. And then we had the health sector strategic plans, and the subsequent guiding document was the National Plan, Accelerated Plan for Reduction of Maternal Mortality. And this was the working document. If you read that document, it clearly states that Tanzania was required to reduce maternal mortality from 578 to 193. And this was looking at a very ambitious target by 2015. So the interventions which have been articulated in that document include scaling up comprehensive emergency obstetric care services. And it required that by 2015, you would have covered 50% of the health centers to have CMOC, 80% of hospitals to provide the CMOC, and 70% of the dispensaries to be able to offer the required services. Now, beyond this, the policy environment that I've described, what really made this program successful, the idea was conceived from the local community, from the local doctors. And allow me to mention the late Dr. Mbaruku, God may continue to rest in peace. He conceived this idea that if you look at the geography of Kigoma, for those who have been to Kigoma, you look at the Lake Tanganyika shores and everything. There are communities that are to imagine you have a postpartum hemorrhage, a woman bleeding, you have a ruptured uterus, you have obstructed labor. It is impossible. Certainly this will be another registered death. So from the initiative by Dr. Mbaruku, and with this policy guided by the Ministry of Health to scale up comprehensive emergency obstetric care, reaching over 16 health facilities. And the dream was really to have the facilities with a minimum of two hours from the neighboring community to be able to reach this care. And this was made possible over the course of implementation. By the time the program was coming to an end in 2019, we had about 61% of the communities could actually deliver in facilities we were providing CMOC services. But also, as a result of this, we had facility deliveries going the way to 80%, which was almost double from the time the program started. As a result, maternal mortality declined by 43%. We had also neonatal mortality declining. And the reason we are connecting this program essentially gave us a lesson that it's really feasible to bring care from high-level hospitals to the health centers. And the ministry was there to listen. We had a lot of forums, including the Big Disaster Now Lab, for those who remember 10 years ago. I was very lucky to be invited here, and we had a lot of critical discussion with the experts, including Dr. Makwani and others. Thus, let's explore this. Let's make this work in the context of Tanzania. And the rest is story that we are hearing here. Beyond that, we had a very good, robust monitoring evaluation. Data, the power of data. You know, if you're implementing a very good intervention, a very good program, if you do not measure the progress that you are making, it is almost useless because you don't know where you're making the right direction. So here we had the U.S. Center for Disease Control and Prevention, which was leading the evaluation. And being a technical lead in that, I was always in my toes. I know CDC, at the end of the year, they come back and ask me why facilities are not offering CMOC. So always you work with the data, work with the local facility, local experts, trying to advance this work to further heights. And finally, if a key lesson that I would advocate further, this program was so much guided by evidence. We can have very good interventions, but if you're just trying, testing every time, it was guided by evidence. We all know that majority of maternal mortality would come from the big five that are contributing about 70%. And to be able to take care of them, you need availability of quality. Key quality is very important. Quality emergency obstetric and newborn care. So we had a very robust quality improvement initiative, including clinical audits over the complications, not in the national guidelines, but we made a decision that if WHO is recommending this very strongly, the evidence is there, then we scaled up the use of TX in the facilities, and then that initiative came to the level of the ministry. It was captured in all the relevant guidelines, and the rest is the story again. So, rather, I'd be able to explain a lot more, but I think time is very limited. The key message here is you have to have the right enabling environment, have the clear concepts developing from the grassroots, have the right people take it forward, and most importantly, please ensure you are scaling up evidence-based recommendations. Thank you very much.
Thank you, Sunday. As a student of learning more about the maternal and newborn health field from the Gates Foundation, many of the most transformative studies in this field, whether it's...
Thank you very much, Rasa. So in terms of looking at evidence, I would start by saying context is crucial in shaping health priorities and policies in any country. But of course, locally generated evidence is essential in forming those policies and priorities. For instance, when you look at epidemiologically, not only do health challenges in Tanzania differ from those in other parts of the world, but also the feasibility and adoption of solutions also vary globally. Citing an example, we all know that the World Health Organization recommends calcium supplementation during pregnancy. However, high costs, dosing complexities, and logistical challenges to help see how we can bring this intervention to pregnant women in Tanzania. We hope that we can pave a way and many countries can also follow. But looking back again, in over 40 years, the standard care for antenatal services has been provision of iron and folic acid to pregnant women. But again, evidence, including research studies done here in Tanzania by our own researchers, has also demonstrated that the provision of multiple micronutrient supplementation, which includes iron and folic acid, together with 13 birth, preterm birth, and mortality. And therefore, again, this speaks about the importance of ensuring that our own evidence can really be used to advance and improve our guidelines. If I speak of mainly two issues here, is challenges on implementation of existing guidelines, such as the ones that we have contributed to building the evidence, and the WHO has given this recommendation. The second point I would like to touch upon is on the importance of testing different innovations. It is important that we are able to be part of testing these interventions and ensuring that in the process we have the confidence with the data to be able to say, why not as a country, confidently that we've been able to advance these efforts for scaling up for a much more impactful improvement, especially of the SDGs, maternal, neonatal, and child mortality. Thank you.
Thank you, Mary. We're going to go to just one final question for each of you on the panel to keep us on time. One of the path ahead is between now and really trying to reach the 2030 goals. What advice do you have to all of us gathered in the room, policymakers?
I've seen some of the projects whereby they've changed from giving partners, instead the government becomes a center of implementation. The value for money, you can account it very, very easier. And I speak this with the passion, saying that if all the resources were real targeting this Tanzanian, we would have attained neonatal care. There's no doubt that the under 5 mortality rate that we see very, very high, 2/3 is being contributed by the under 5 by the neonatal mortality. And if we are able to break that ceiling, that means the under 5 mortality, it will be like a crashing ceiling down. And that is only possible if neonatal care unit, that neonatal care unit has required equipment, therapies, we have the right medicines, and then only if we have a concerted approach whereby we are saying we want to target this intervention together and we will work it together under the full 100% leadership of the government. Whether it goes to the partner, but the partner, whatever does, the government must say, you have to do this. We have to account the resources we put on it. That is my biggest advice I wish. Because we have seen, we have learned with a few resources which have been directed to the government, the value for money, you see it. We need to work with the government, again, to ensure that it is adequate human resource. To be sincere, we are happy. The little human resource we have managed to attain these results. But there are people who spend many, many hours, overtimes, to make sure we get these results. And they are doing that simply because there is inadequate human resource. Again, if the resources were concentrated and we sit with the government and say, here you have a challenge of human resource. Please, we want to support you with this amount of funds. Try to fill the gaps. These gaps could have been filled very, very easily. So for me, I can see the light at the end of the tunnel. 2030, we are likely to get. in materials like neonatal care, issues like nutrition. We need a concentrated approaches whereby the resources, all the resources which come in country are tracked, and we make sure they get to the right people. I submit to you.
Yeah, that's critical. Thank you so much for that. Thank you. Yeah, I think that's critical. Sunday.
Thank you very much. I started first by agreeing with Dr. Makwan that we need the resources that are real streamlined. And the question of human resource is working on MPDCR. I've learned that when I talk about quality of care, it's a very big blanket, but I would like to zoom in and say that essentially among the key issues that you have to address is the competence of healthcare providers who are managing complications. Of course, the current workforce that we have, they are really doing a good job. Indeed, we have to optimize their capacity by continuing to do more. And here, allow me to mention we have a mentorship program, which is very much named the Mama Samia Mentorship Program, Dr. Samia Mentorship Program, which really we have been working with the professional experts from professional associations to build the capacity of healthcare providers in their facilities on site so that they continue to offer care while also learning the new skills. I think these are the kind of innovation and interventions that we should always continue to push and do more so that all the healthcare providers in the facilities know exactly what to do when they encounter a mother or a newborn with complications and be able to take the necessary actions, and if possible, if not within their capacity, they should be able to refer promptly and beyond. And another thing that I think is very important look forward is we should look at our health system in a very comprehensive way. For example, you may have a program that supports, say, scaling up of emotive bundle, very good innovation. But however, beyond the PPH, you have other issues which are around. Providers may be having no skill. When it comes to the professional work that is done everywhere, we should always leverage on the professional societies because of the greater network they have, down the grassroots up to the facilities level, but also the expertise the professional society bring on board. These together, when they work with the government and other key players, we are really going to maximize the action that we do on the ground. And you can make the thing happen finally. Final point, newborn care. Live birth, which translates to over 50,000 neonatal deaths per year. That number needs to come down. It's not by talking. We have to invest on scaling up facilities that can offer comprehensive newborn care services, level 2 facilities, which can ensure that babies who are coming with several complications can be treated at nearest facility as much as we are doing for CMOC. Thank you, Raza.
Thank you. Those are great lessons and really important to facilitate groups coming together to make sure it's comprehensive. I agree. This is not a simple task to just divide and go one after the other. Mary, please, last word with you.
Thank you very much again, Raza. So I spoke earlier about challenges in implementation of already existing interventions. Maybe I would like to touch a little bit about innovation, the importance of testing new innovations. And here we understand that maternal and child undernutrition are really precursors of poor prognosis, health prognosis overall. A mother is undernourished and she's carrying a baby. One can imagine the baby may be born too early, may be born underweight and all that. And therefore, this really brings us to a call. We understand what happens. We have seen progress and improved health outcomes. And therefore, we need to be ready to also be innovative. For instance, right now, we have women being seen at antenatal clinics. How can we best innovate on the way that we can be able to much better monitor their HB? And how can we integrate, for instance, nutrition supplementation programs? Or else, how can we better manage severe forms of anemia? Can we find ways in which that we can provide IV iron, for instance? So all these experts know what works. But how can we best innovate within our constrained health systems so that we can much better do a better job? But just to speak a little bit more, we actually have to enhance nutrition for women and children, but how do we work multi-sectorally so that multiple micronutrient supplementation? Can we look at regional development, regional production of nutritional commodities such as MMS, but also looking at innovations in data systems so that as we monitor, if we're to roll multiple micronutrient supplementation or also implement calcium in our guidelines, how can we ensure that our data systems, while we are monitoring the integration of these new interventions, is also able to give us the ripple effects of understanding how we're making progress going forward? Maybe I stop there and thank you very much.
Thank you so much to my panelists for your time today. You have distilled the immense experience that each of you has knew this so that we can achieve the goals. I'm thankful for that. Our partners, thank you for having us here, and we look forward to the rest. Dr. Anapokea, over to you.
Great work, Dr. Rasa Izanegadar. I got it?
You got it.
Wasn't the conversation insightful and fascinating? That's what it takes when you start walking the talk in the health sector. Tanzania has been working to improve the health and lives of mothers and children for many years. Yesterday, somebody whispered to me of Her Excellency's experience with Kidonge Chekundu. Remember that? Your Excellency, that is what today we need to go for the much lauded. Progress is not always linear. You heard from the panelists. It does tend to build itself over time. Time is of the essence. Your Excellency, I beg for your indulgence. My brother Albert Chalamila was not called out when I was introducing the dignitaries in attendance. Please, that is mine. But feel welcome, as others were made to feel welcome. All right, we are gathered here today to award the Global Goalkeeper Award to one of the most steadfast leaders behind the momentum we have in Tanzania. Now, we go back to the Global Award. The Global Goalkeeper Award is given in recognition of individuals who have pushed their countries closer to reaching the global goals by 2030. These are individuals whose determination and vision do get hard things done. I need to underline that. Bold underline. They have the ability, the vision to get hard things done and inspire all of us. Your Excellency, cutting down on maternal mortality from 556 to less than 150 is a good achievement, except one life lost is one. So here to talk about this achievement and the way to achieving this dream is none other than the President of Gender Equality at Gates Foundation Division, Dr. Anita Zaid. Please welcome.
Karibunu Sana, Assalamu alaikum, and welcome everyone. Thank you so much for being here today. For Your Excellency, Madam President Samia Hassan, for the impressive progress that has been made in Tanzania, that you have the countries that is actually on track to achieve those goals. And you can see the fruits of that promise in the fact grow up to celebrate their 5th birthday. And that young people have real optimism that they will live the lives that they dream of. I am the president of gender equality at the Gates Foundation, but I started my career as a pediatrician, and I'm from Pakistan. And I can't tell you how many young women I saw who died during childbirth, and too many babies that did not live to see their first month or to see their first birthday. In short, I saw the consequences of ignoring maternal health, of ignoring child health, and of ignoring one of the biggest drivers of maternal and child deaths, which is malnutrition. In 2021, President Samia Suluhu Hassan became the first female president of Tanzania, and she has shown that she understands those consequences too. Under her leadership, the government hasn't just continued the country's work in maternal and child health, it has decided to do even more. The government built many new facilities with a comprehensive obstetric care, and they expanded the services that they provided so that women could be served. They embraced the use of maternal health data, really crucial, to deliver the right solutions to the women who need them. And they extended the fantastic program M-Mama, the transportation program, so that new and expected mothers could get to a health facility if they were, that they have access.
Your Excellency, Dr. Samia Suluhu Hassan, the President of the United Republic of Tanzania, Honorable Dr. Philip Isdori Mpango, Mrisho Kikwete, the former President of the United Republic of Tanzania, Honorable Amani Abedi Karume, the former President of the Revolutionary Government of Zanzibar, Honorable Dr. Tulia Ackson, the Speaker of the National Assembly, ministers who are present here today, Dr. Anita Zaidi, the President of Gates Foundation, Health Equity and Gender Division, Balozi Kusiluka, the Chief Secretary, United Republic of Tanzania, Engineer Zena Saidi, the Chief Secretary, Zanzibar, Regional Commissioner, Dar es Salaam, representatives of Gates Foundation, all government officials, distinguished guests, ladies and gentlemen. Na wasalimu kwa jina la Jamhuri ya Muungano wa Tanzania. Tuzo yetu ya kimataifa hoye. Asanteni sana. Your Excellency President, it is with great honor and pride that I stand before you today on this momentous occasion. We gather here to celebrate not only an award, but remarkable recognition of your visionary leadership and dedication to the well-being of our Tanzanians. You has bestowed upon you these prestigious goalkeepers and annuities in the year 2020 to the number of 9,008. Apart from that, we have also emergency medicine department from 7 hospitals in the year 2020 to 113 in the year of 2024. Your Excellency President, our government increased the number of health facilities providing comprehensive maternal and neonatal care from 340 in 2020 to 523 in the year 2024. Your Excellency President, availability of essential health commodities increased massively from 73% in 2020 to, Madam President, our government have managed to strengthening the 9 digital X-ray machines and 625 ultrasound machines. We have strengthening partnership with the global health organizations and the other development partners. And currently, Your Excellency President, we have introduced the new law on universal health insurance as our country commitment to achieving universal health coverage for all Tanzanians. Your Excellency President, this award also acknowledges the determination of our health care professionals, our doctors, nurses, community health workers, and our researchers who work tirelessly to improve the lives of across the whole country. Your Excellency President, to the Gates Foundation, I would like to extend my deepest gratitude for recognizing Tanzania's future where no one is going to be left behind. As we celebrate this achievement, let us together reaffirm our collective commitment to advancing health equity, solving global challenges, and building a nation where every Tanzanian citizen has access to the quality health care we deserve. Your Excellency President, let me take this opportunity once again to thank you for accepting this award today. And I would like humbly to take this opportunity to welcome the Vice President to give the remarks and to welcome you to
Hongera sana Mheshimiwa Rais, tunakushukuru kwa dhati. Tunawashukuru kwa dhati wakfu wa Gates kwa kukutunukia tuzo hii ya heshima ambayo ni uthua mbele katika kujenga taifa ambalo kila mwananchi anapata huduma bora zaidi za afya. Mheshimiwa Rais, bila kupoteza muda, ninayo heshima kukukaribisha uzungumze na hadhara hii. Mheshimiwa Rais, karibu.
Mheshimiwa, tukae. First. Okay. Tukae. Waheshimiwa, kwa sababu hakuna translation, tazungumza lugha ambayo wenzetu wanatuelewa. Tutatafsiri baadaye. So Excellencies, former President Dr. Jakaya Bishop Kikwete, former President of the United Republic of Tanzania, and Dr. Amani Karume, the former President of the Government of Zanzibar, Revolutionary Government of Zanzibar. Your Excellency Dr. Phil Newborn Child Nutrition and Health at Gates Foundation, and the delegation from the Gates Foundation, heads of security organs here with us, distinguished guest members of the press, ladies and gentlemen. Policy. Number of registered medical specialists, obstetrics and gynecologists from 69 in 2020 to 338 in 2024. Secondly, we have been offering free maternal and under 5 health services. We have also strengthened the referral systems by producing 727 ambulances in 9 years from 2015 to 2024. The gap between rural communities strategies, including the use of technology in nutrition assessment by procuring COBAS machines. These machines have strengthened the capacity of our national laboratory to conduct nutrition-related analysis, such as the use of biological samples to assess nutritional status. By using local expertise collectively, these various interventions have increased the rate of wasting among children under the age of and to 12% over the same period. Here, we haven't done much good, but then it's a progress, and the journey continues. We are continuing to take required measures to continue reducing the underweight, the stunting, and the malnutrition. Fifth, we have been implementing a national such as climate change, regional outbreaks, and economic inequality remind us the 25 years period from the year 2025 up to this year. I'm happy to note that since then, years in 2022, over the next 25 years, we aim to further invest in health and increasing accessibility. Over the next 25 years, we aim to further invest in health and increasing accessibility.
The audience, yes, Dr. Mpango and President Kikwete. Please come to the stage. Madam Speaker, please. so much. Let me go back to your seats. I'm reminded that the
come about, and under your leadership, why have you chosen this to be such a big cause for you?
Thank you, Anita, for that question. You know, as a woman and a mother, I've gone on.
Thank you.
we've come to the end. I want to believe gracing this occasion. And ladies and gentlemen, shall we stand as each one of us takes their leave? And God bless each one of you.